Hello, I'm gonna be your nurse today. My name is Mia. Could I just have you confirm your name and date of birth for me really quick? Okay, perfect. So it looks like today we are going over a new medication that your provider prescribed for you. So it is called tiotropium. It is a inhaled medication. It's for your COPD. It's more of a long-acting medication, so it's going to work over time and help you start to manage that COPD. And so what you'll want to do is inhale 1 capsule once a day, every day, using the HandiHaler device that we're going to give you. So how you're going to use that is you're going to open the dust cap and then the mouthpiece and insert the capsule, and you're just going to insert 1. It is an 18 microgram capsule, so just 1. You'll put that in there, and then you'll close the mouthpiece, and then there's a little button on the side that you're going to press so it like pierces the capsule, kind of opens it up. And so once you do that, you'll breathe out completely and then put the device into your mouth and breathe in a way that you can kind of hear that capsule rattling, and you'll just want to kind of breathe in as long and like as much as you can so you can get all of that medication in. And we can give you kind of a video tutorial about how to do that, but that's how you're going to be doing that. That's just 1 capsule once a day, probably about the same time every day, probably in the morning. You will want to avoid kind of other anticholinergic drugs such as atropine or scopolamine. I don't know if you've heard any of those, but yeah, just avoiding those since they are similar. And you kind of want to limit your caffeine intake because this medication can increase your heart rate, which is what caffeine does as well. So just limiting the caffeine intake. And so some other side effects could be depression, dry mouth, blurred vision, vomiting, abdominal pain, or cough. Some other kind of side effects could be, like I said, that increased heart rate, or like AFib. And what we'll want you to notify your healthcare provider about is if you are having like chest pain or kind of like that increased heart rate over a long time. Yeah, like the AFib kind of feeling in your heart, or even hives. You want to call your provider or come in and let us know so we can kind of help you manage those symptoms. So you will know this medication is working over probably a couple days to a week. You'll start to notice just kind of an easier time breathing. You'll notice less wheezing or shortness of breath, and kind of you'll notice your need for your short-acting inhaler less. You'll notice you're starting to need that less. But yeah, are there any other questions? And I can give you a pamphlet to go home with, and you can always call us if you have any other questions. Okay, perfect. And then just as the nurse, some other considerations we are going to look out for are this can increase cholesterol and glucose. So just watching their food intake, limiting sugar, limiting those cholesterol foods. This medication could cause some urinary retention or UTI. So I guess just kind of helping them educate on like wiping front to back, or just kind of those kind of education pieces. It can cause AFib or kind of that increased heart rate, so we may want to hook them up to cardiac monitoring just to watch for their heart. Assessing the respiration status, like their rate and kind of their like breath sounds before and after the treatment, just to kind of see how that is helping and affecting them. Just kind of watching out for that cough and the wheezing, seeing if those symptoms start to improve, and kind of just assessing their overall long-term toleration of the medication, and seeing over time if it is actually working for them and how those symptoms are working for them.